The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello, and welcome to Wonderfully Made. This program is designed to provide information and encouragement in promoting good health habits. My name is Don Morgan, and I teach in the Department of Health and Human Performance at Middle Tennessee State University. This is the seventh in a series of programs focusing on the health benefits that come from being physically active on a daily basis. In today's program, we're going to be talking about the growing epidemic of diabetes in the United States and the positive role that physical activity and exercise can play in helping to treat and manage this disease. Let's first define what is meant by the term diabetes. Diabetes is a group of diseases that are characterized by high levels of sugar or glucose in the blood. Glucose is used by the body to provide energy to power many body functions. People with diabetes have increased levels of blood glucose because of a lack of insulin or resistance to insulin's effects. Now, what is insulin? Well, it's simply a hormone released by the pancreas gland that helps glucose to enter into many body tissues. Hence, when there are defects in either insulin production or insulin action, glucose can build up in the blood and spill into the urine. As a result, the body can lose a main source of fuel. How many people in the United States have diabetes? According to the Centers for Disease Control, nearly 21 million people, or 7% of the U.S. population, have diabetes, defined as a fasting blood glucose levels of at least 126 milligrams per deciliter. Over 14 million people have been diagnosed with diabetes, while more than 6 million have the disease but have not yet been diagnosed. Another 41 million Americans have a condition called prediabetes, in which blood glucose levels are higher than normal, but are not high enough to warrant a diagnosis of diabetes. Based on information from the National Institutes of Health, having prediabetes can predispose you to a greater risk of developing diabetes and a higher incidence of heart attack and stroke. In 2005, 1.5 million new cases of diabetes were diagnosed in people aged 20 years and older. And by the year 2025, it is estimated that diabetes will affect nearly 9% of the U.S. population. The following graphic shows the spread of diabetes in the United States over the past decade. What is of interest to note is that in 1994, only Louisiana and Mississippi, pictured in dark blue, only these two states exhibited an age-adjusted diabetes rate of at least 6%. However, in 2004, 39 states were colored in dark blue, reflecting a startling increase in the national incidence of diabetes. Over 200,000 people die each year from diabetes-related complications, and the overall risk of death among people with diabetes is about twice that of persons of similar age who do not have this disease. From an economic perspective, the estimated annual financial burden of diabetes in the United States is $132 billion. While the prevalence of diabetes is highest in adults who are 60 years and older, the greatest number of new cases has been observed among middle-aged adults. It is also important to note that diabetes is not just an adult disease, but is also being diagnosed with greater frequency in children and teenagers. As shown in the next graphic, the Centers for Disease Control estimate that 1 out of 3 children born in the United States in the year 2000 could develop diabetes in their lifetime. Diabetes can be classified as either type 1 or type 2. In type 1 diabetes, little or no insulin is available as a result of genetic or environmental factors that destroy cells in the pancreas gland. That is where insulin is made. Hence, persons with type 2 diabetes must take insulin daily to function and live. Type 1 diabetes accounts for about 5 to 10% of diagnosed cases in the U.S. and develops most often in children and young adults. The onset of type 1 diabetes is usually abrupt and is generally accompanied by frequent urination, constant hunger, excessive thirst, and unexplained weight loss. Type 2 diabetes, on the other hand, is the most common form of diabetes and accounts for 90 to 95% of diagnosed cases. This type of diabetes can develop at any age, even during childhood. In this form of diabetes, the pancreas usually produces enough insulin, but the body can't use it effectively and develops what is known as insulin resistance. To overcome this resistance, the pancreas attempts to make more insulin to facilitate the entry of glucose into the body cells. Unfortunately, over time, insulin production may begin to diminish. The result is the same as what happens for those individuals with type 1 diabetes. Glucose levels in the blood can increase to abnormally high levels. Lifestyle factors can play an important role in the development of diabetes. In the United States, approximately 85% of individuals with type 2 diabetes are obese at the time of diagnosis. This has led to the coining of the phrase diabesity to describe the close association between type 2 diabetes and elevated levels of body fat. In a 5-year study of 20,000 men, the risk of type 2 diabetes was tripled at a body mass index that exceeded overweight standards. A similar trend linking increases in body mass index to a greater age-adjusted risk in type 2 diabetes was also observed in a group of 114,000 women who were studied for 14 years. The risk of developing type 2 diabetes also rises with an increase in waist circumference. In one study of more than 43,000 women, it was found that a 10-inch difference in waist circumference, in this case going from a 28-inch waist size to a 38-inch waist size, that 10-inch difference translated into a 6-fold increase in the risk of developing type 2 diabetes. Other evidence indicates that when body weight and abdominal fat are lost, there is less resistance to the effects of insulin, and levels of blood glucose are either reduced or are returned to normal. What is the role of physical activity in treating diabetes? In discussing this topic, it's important to recognize that physical activity has been used to treat diabetes for thousands of years. Moreover, even after insulin was isolated in 1922, exercise was considered, along with diet and insulin, as an important part of the treatment regimen for diabetes. Before we delve into exactly how physical activity can impact the management of diabetes, I want to look first at the overall relationship between physical activity and the risk of developing diabetes. Data from a number of studies have provided convincing evidence for the role that regular exercise can play in reducing the risk of type 2 diabetes. In one study, the risk of type 2 diabetes increased as physical activity levels declined and time spent watching TV increased. In another study, it was demonstrated that persons with low levels of leisure time physical activity were at the highest risk of developing type 2 diabetes. While the lowest risk of type 2 diabetes was observed in the most active group, those individuals who displayed moderate levels of physical activity demonstrated marked reductions in disease risk compared to the least active group. This finding is consistent with what we have talked about in earlier programs. That is, that numerous health benefits can be gained by performing moderate physical activity on a regular basis. Exactly how does physical activity aid in transporting blood sugar into your muscles? When physical activity is performed, your muscles contract. And when they do, an insulin-like effect is created. What that means is that when you're physically active, glucose uptake into your muscles increases by 7 to 20-fold compared to resting conditions. Within the cell, muscle activity signals what are known as glucose transporters to migrate to the cell membrane and usher glucose in. Since muscle activity produces an insulin-like effect, less insulin is required to move glucose into your muscles. Conversely, during and following exercise, skeletal muscles display an increased sensitivity to the available insulin. What this means is that for any given level of insulin, more blood glucose can be moved into the muscle, and this effect can last anywhere from several hours to a few days. With training, insulin sensitivity is elevated due to an increase in the total content of glucose transporters and a stronger insulin effect at the cell level. This increase in insulin sensitivity is what makes physical activity so useful in treating persons with diabetes, since it reduces the need for insulin while helping to lower blood glucose levels to more normal values. Regular exercise and physical activity can improve the health and quality of life of both type 1 and type 2 diabetics. Regular aerobic and resistance training, when combined with dietary therapy, can result in better aerobic function, favorable changes in cholesterol profiles, decreases in weight and blood pressure, and greater lean body mass. In addition, daily physical activity can help to improve the psychological state of the diabetic by raising self-esteem and lowering depression and anxiety. Regular physical activity can decrease the insulin requirements of well-controlled type 1 diabetics by 30 to 50%. With each bout of exercise, the improvement in insulin sensitivity can last for 1 or 2 days before returning to pre-exercise values. This finding highlights the importance of being active on a daily basis so that you can take full advantage of the enhancement in insulin sensitivity that comes from engaging in single bouts of physical activity and exercise. Before starting an exercise program, the type 1 diabetic should undergo a comprehensive medical screening, since strenuous exercise can aggravate eye, kidney, or nerve problems that may already exist. While the risk of hyperglycemia or high blood sugar can be present in some type 1 diabetics who are not in good control of their blood glucose levels, the primary concern for these individuals is to avoid hypoglycemia, or low blood sugar, which may occur when exercise is prolonged or too intense, or when blood glucose levels are low prior to the start of exercise. Given the insulin-like effect created by muscle contraction, individuals with type 1 diabetes who exercise regularly will require smaller than normal insulin doses or will need to increase food intake to maintain appropriate levels of blood glucose. For the type 1 diabetic, exercise should be performed at the same time every day, at about the same intensity, and for the same length of time. The overall goal is to strive for regularity and to avoid unplanned exercise as much as possible. The most appropriate exercises for type 1 diabetics are those with predictable levels of activity, like walking and cycling. They should also avoid heavy resistive exercise or prolonged intense aerobic activity that may exacerbate eye and kidney problems due to marked increases in blood pressure. It is strongly recommended that type 1 diabetics adopt a regular pattern of exercise and diet, with frequent blood glucose measurements to test the body's response to a given exercise load. Each person with type 1 diabetes is unique and will need to discover, through frequent and routine blood glucose monitoring, the optimal schedule of diet, physical activity, and insulin dosage that produces a blood glucose range allowing for safe exercise participation. In summary, the individual with type 1 diabetes has much to gain from engaging in daily physical activity because of the potential to enhance cardiovascular fitness, control disease risk factors, heighten psychological well-being, and improve overall quality of life. For the individual with type 2 diabetes, physical activity and exercise can enhance long-term diabetic control by reducing insulin resistance and improving insulin sensitivity. As with type 1 diabetics, persons with type 2 diabetes should undergo a thorough medical examination to uncover previously undiagnosed medical complications that may have arisen as a result of the disease. A number of risk factors are associated with type 2 diabetes. As shown in the following graphic, they include age, being 45 years or older, having a body mass index of 25 kilograms per meter square or more, which would suggest the presence of overweightness or obesity, having a parent, brother, or sister with diabetes, having a family background that is African American, American Indian, Asian American, Pacific Islander, or Hispanic American, gestational diabetes, or giving birth to at least one baby weighing 9 pounds or more, having a blood pressure reading that is greater than or equal to 140/90, or being told that you do have high blood pressure, exhibiting HDL cholesterol readings that are less than 35 milligrams per deciliter and triglyceride readings greater than 250 milligrams per deciliter, displaying low physical activity levels, and exhibiting prediabetes, defined as having a fasting glucose reading that is between 100 and 125 milligrams per deciliter. Near daily physical activity performed at a comfortable intensity and lasting between 20 to 45 minutes is recommended for the type 2 diabetic. The importance of performing physical activity as part of a regular routine cannot be overemphasized, since the residual effects of a single exercise bout on insulin sensitivity and glucose control last for only 1 to 2 days. Moreover, weight loss, which can spur improvements in insulin sensitivity, is promoted with daily exercise. Both large muscle aerobic activities, like walking, cycling, and swimming, and high repetition resistance training, both of these can enhance insulin sensitivity and the overall management of blood glucose levels. Interestingly, skeletal muscle is the largest mass of insulin-sensitive tissue in the body. Thus, exercise training and daily physical activity can help to alleviate insulin resistance by preventing muscle atrophy and building muscle mass. What is the combined effect of diet and exercise for the person with type 2 diabetes? This question was addressed in a report published in 1994 that involved 652 patients with type 2 diabetes. Study participants were part of a 26-day program that featured a low-fat, low-salt, low cholesterol, high fiber, high carbohydrate, primarily vegetarian diet that was combined with walking exercise lasting 1 to 2 hours per day. Results from this study indicated that in less than 1 month, 39% of the participants were able to stop their insulin therapy. In addition, nearly 3/4 of the patients taking oral hypoglycemic agents were able to discontinue their use. As shown in the following graphic, the program produced, on average, a 5% loss in body weight, a 7% decrease in systolic blood pressure, a 15% reduction in fasting glucose levels, a 22% reduction in total cholesterol values, and a 33% decrease in triglyceride levels. While it is difficult to determine whether diet, physical activity, or weight loss was the primary factor responsible for these improvements in fitness status, these findings provide clear support for the notion that positive changes in lifestyle can improve the health profile of type 2 diabetics. In a more recent study published in the New England Journal of Medicine, over 3,200 persons with prediabetes were assigned randomly to one of 3 groups: a placebo group, which received standard lifestyle recommendations, a medication group that received standard lifestyle information and an oral drug that increased insulin sensitivity, and a lifestyle modification group that combined a healthy, low-calorie, low-fat diet with moderate physical activity, like brisk walking, that was performed for at least 150 minutes per week, which would translate into 30 minutes of activity 5 days a week. Data from this study revealed that persons in the lifestyle modification group exhibited a much greater change in weight compared to the drug or placebo group. Furthermore, the incidence of diabetes was 58% lower in the lifestyle group versus the placebo group, and 39% lower in the lifestyle group compared to the medication group. Clearly, this study demonstrates that simple lifestyle changes can be quite effective in preventing the onset of type 2 diabetes among individuals who are pre-diabetic. In earlier programs, we've talked about the many health benefits that come from walking. In a recent investigation published in the journal Archives of Internal Medicine, the relationship between physical activity and mortality was examined in nearly 2,900 adults with type 2 diabetes. Compared with inactive individuals, those who walked at least 2 hours per week displayed a 39% lower death rate from all causes and a 34% reduction in mortality due to cardiovascular disease. In those persons who walked at moderate pace for 3 to 4 hours per week, or about 30 minutes per day, mortality from all causes was reduced by 54%. This protective effect of physical activity was observed for persons of varying sex, race, body mass index, diabetes duration, and physical limitation. In an editorial that accompanied the article, Dr. Frank Hu from the Harvard School of Public Health concluded that walking is probably the, quote, best medicine, unquote, for preventing and treating diabetes. While regular physical activity can confer many health benefits, the presence of specific clinical conditions must be considered when designing an exercise plan for diabetics. For those individuals with the complication of retinopathy or damage to the tiny blood vessels of the eye, it's important to avoid strenuous, high-intensity activities that involve breath holding or the lowering or jarring of the head. Neuropathy, or nerve damage, is another potential medical condition that must be considered when recommending exercise for the diabetic. In the case of peripheral neuropathy, which affects the extremities, especially the legs and feet, one should avoid exercises that can cause foot trauma, like prolonged hiking and jogging, or walking on uneven surfaces. For these individuals, non-weight-bearing activities like cycling and swimming can be a useful alternative. Keeping the feet clean and dry, choosing shoes that fit properly, and visually inspecting the feet on a regular basis are other steps that can be taken to lessen the consequences of this condition. For the diabetic who has high blood pressure, heavy weightlifting and breath holding should be avoided, and low to moderate intensity exercise involving large muscle groups like walking and cycling should be emphasized. Diabetics can also suffer from nephropathy, which involves damage to the small blood vessels in the kidneys. In this case, one should avoid exercises like weightlifting and high-intensity aerobic exercise that can increase blood pressure to high levels. For the active diabetic, exercise-induced hypoglycemia can be prevented by monitoring glucose levels prior to and following activity, and by decreasing insulin dosages based on the duration and intensity of exercise, as well as by personal experience. To end, let me just recount a statement that someone told me once who had diabetes. He told me, "Don, when I walk on a regular basis, I don't have diabetes. But when I fail to walk because I'm too busy, my diabetes returns." There is so much power contained in being physically active. Remember that, and I'll see you next time. Goodbye.